As a parent, you probably have a lot of questions on why your baby may or may not be able to breastfeed efficiently. And from a dental standpoint, the major two reasons that infants have all sorts of problems latching onto the mother's breast is because their tongue doesn't function correctly, and that's called a tongue tie. And if the upper lip won't extend upward, that's called a lip tie, and that will prevent you from getting a deep latch. And really, all of the problems that are associated with a mother who's having breastfeeding problems under normal circumstances is really based upon the fact that the infant can't latch properly. There are more than enough studies in the literature to show that releasing the infant's tongue is beneficial. And let's think about it. When we're talking about breastfeeding, this is a procedure that enables the baby not just to nurse and have nutrition, but it affects the development of the entire facial musculature. Babies who are tongue-tied may have sleep apnea, which studies are now showing can cause hyperactivity in children later on because of reduced blood supply to the brain. A lot of babies are diagnosed with reflux and colic and are put on medication when really all you need to do is release the tongue and the lip so the mother has a deep latch. So if your infant is latching and doing a lot of clicking, this is going to cause aerophagia, which is causing your baby to suck air into their belly. That's what's giving you a problem. So when physicians put your child on medication for what they call acid reflux, it's not doing anything, because unless you stop the clicking, it's not like an adult who has true acid reflux. This is a buildup of air in the belly, which is causing your baby to either come out as gas or throwing it up. In your terms, your nipples get sore because the baby doesn't latch right. So if you were to take your finger and put it into the baby's mouth and have them suck on it, if that baby's sucking on your fingernail, they're biting your nipple. Once we release the tongue and the lip, what that enables the baby to do is to move up here between your two knuckles. That will allow the baby to get a deeper latch, and almost all the problems will resolve very quickly. Now, saying that, some babies, it's immediate. They're real quick learners. Some babies who are a little bit older, who have been having problems, have bad habits. And I've had infants go from immediate, perfect nursing to take 2 or 3 weeks. Also remember, this is a team effort. Okay, too many people, they go to the surgeon or the dentist and they have the procedure done and there's no follow-up. And I'm not talking follow-up with us, but you need to improve your latch by seeing your lactation consultant, and many times some body work to help relax the baby. If you see the doctor and you're not seeing a good improvement, that's because you haven't followed all of the post-surgical directions. And it's very important to remember, we can release and resolve the problem, but you have to be able to maintain the area and prevent it from healing back together. It's not really reattaching. You have to do what we call active wound management, which maintains that area. If you don't do that and it heals back together, you're going to be back to step 1 because your symptoms will reoccur.